As you know, I've been involved in complications management for a long time, and one of the things that we always want to do is perfuse the tissue as much as possible. And as Lana said, the hyperbaric oxygen, it's A, expensive, and B, who's doing it? Where'd you send the patient to, and who pays? So that's one of the things. I'll give you an example. We had a vascular occlusion from another practitioner in where I live, and geographically it's not too far away, so it's around about 10 miles, but it was $6,000 for the treatment. So who pays that? Is it you? Is it the patient? I think if you caused it, you're going to have to pay that. So for us, if you go to the hospital's not going to entertain it. So hyperbaric oxygen, if you know where it is, does it work? Again, it's mixed. What we know is that placing topical substances on the skin is very effective for the microcirculation. We know that. It's very simple. You just stick some lidocaine paste on. What happens? Yeah, you have a vasodilatory effect. Not just a vasodilatory effect. What you want to do is create an environment where you're increasing oxygen. And with CO2 Lift, you're creating a balance where you have the oxygen saturation curve dropping down, and it releases every single bit of oxygen it's got to the skin, because it's called the Bohr effect. And that is super important. We used to try to do that with GTN paste. But again, if your patient isn't cardiovascular fit, and you have to keep slapping it on every 2 hours, it's pretty tedious, and they can get palpitations, flushing, headaches. You don't have that with this. So you've almost got a little hyperbaric gel that you place onto the skin, and I think it's going to form really the mainstay part of your treatment for vascular occlusions. Because when you're delivering hyaluronidase, there's going to be a period where you can't touch the patient. It's too painful. Maybe the patient's a couple of days. CO2 Lift cream, putting it on is going to increase that oxygenation. It's going to increase vasodilation. So remember, lidocaine will just increase the vasodilatory aspect. What you're doing is two things here with CO2 Lift. You're increasing the perfusion, vasodilation, but you're also increasing the oxygenation. Exactly the two things that you want to. Again, when you've released your vascular occlusion, you'll see a phenomenon called hyperemia, where the skin goes super pink around it. That means that there is now blood flow into it. The area where there's no blood flow needs oxygen quickly. CO2 paste is exactly what you need, and you can do it for multiple days after you don't get the skin breakdown, the blisters, and everything like that. So it's going to form an integral part of your kit. And to just place it in your kit, fine, with your Hylenex, with your lidocaine, those type of things, it's going to be the standard in all complications kit, because there is no cardiovascular effects with this. It's just a win-win situation. All right? That's how I use it. That's what we use it for. Skin healing is incredible.
We did a, thank you so much, Dean, for that. We did a diabetic wound healing study.